Well, deciding when to get home care for a loved one can be very, very tough. It can be top of mind when a crisis happens or as we care about and get to the later stages of life. Now, here to tell us about what we can do and how we can help is Mary Ellen Fleming with First Light Home Care. Hello and welcome to the show. And many seniors, they want to stay in their own home right now. I get it. My mother-in-law, she wanted to stay in her home, but there's some issues that you have to go and face. So how can First Light assist with helping seniors stay in their home?
Well, thanks, Eugene. It's so true. People do want to stay at home, but sometimes things just get harder as people are living much longer, 80, 90, 100, and things like getting the groceries, cooking the meals, getting around safely can all be issues that we can help with.
Now, you also say having a plan really helps out because things were happening with my mother-in-law. Didn't know that she was falling down, but she was falling down. And so those things really become problematic and really traumatic for, caregivers.
Right. So I really advocate for families to have conversations about how you're going to live and what that end of life look like as soon as possible, because most people do call us when they have those crises. But what you want is to be able to go in and help with somebody who, I got a call from a daughter whose mother's hairdresser had called her and said, your mom's showing up at wrong days and times. And so we went in, and 2 days a week, we would one day help with household chores, one day drive her to get her hair done, get the groceries, stopped at Dairy Queen, got her chili dog, what she loved. Those are the kinds of things we can do to just keep people home safer longer.
And my mother-in-law, she's not going to yell at you. She's going to find that welcoming help right there. But sometimes as a caregiver and you're a son or a daughter, you get the blunt for that because you're still the child.
Yes, and when you hire a home care company, you can relieve some of that stress and you can continue to be the son or the daughter or the husband or wife, because we see that so often.
So what are some of the triggering events for families? What have you seen?
So triggering events typically are a health crisis. Somebody falls, somebody gets sick, needs help right away. We can definitely step in that. What we also see a lot, Eugene, is one partner dies, one spouse dies, and they had been taking really the caregiver for the other person. And sometimes the adult children didn't realize how much dad was covering for mom. And those are situations where we can step in right away and provide assistance. So
what about the costs, and what about the different costs? What does that look like?
So costs in Charlotte, they probably range, I would say, from the $35 to $40 an hour range for like one-person care. But to cover those costs, there's different ways. The primary payer is either private pay, the senior or the family member. Long-term care insurance can help with that. If somebody is a veteran, the VA is the number 3 provider of home care as far as cost of paying for it. And there's a new program that traditional Medicare people who have dementia called GUIDE, and we can talk more about that another time, has that can help cover those costs.
So where can people learn more? Because just your demeanor and the way that you're talking about, I want people like you taking care of my peoples.
Well, I would love to, and they can learn more on our website, which is charlotte.firstlighthomecare.com, or they can give us a call at our office. We have a team happy to help.
Well, thank you very much for being here. This is an important topic, and you do a good job.
Thanks so much.
All right.